Thank you.
Minister Gregory Stafford.
Thank you very much, Madam Deputy Speaker, and it's a pleasure to rise and speak on behalf of His Majesty's opposition on this most important debate. And I commend the Honourable Member for Dunfermline and Dollar for securing it, and of course his very heartfelt and passionate speech. And I was particularly moved by the recitation of Bobby's poems and indeed the highlighting of that amazing podcast, Movers and Shakers. And I also want to thank all Honourable Members for their heartfelt contributions on behalf of their constituents and those across the country living with Parkinson's, and some of the really inspiring stories that we've heard, such as Jagdeep, as raised by the Honourable Member for Ilford South, and John and Anne from Something Old and Something New, raised by the Honourable Member for Stirling and Strathallan. I note today, Madam Deputy Speaker, that because of other events that are going on in the country, we've had a relatively Scottish flavour to our debate today. But Parkinson's Awareness Month is a UK-wide month, and it is a time to focus national attention on the condition that affects over 150,000 people here in the UK, a number that continues to rise. This disease impacts not just individuals, but families, carers, and communities. It challenges both body and spirit, demanding a comprehensive response from all sectors of our society. We often only learn about Parkinson's from friends, families, and colleagues, as highlighted so powerfully by the Honourable Member for Glasgow West. For me, this is a deeply personal issue. A close family member was initially diagnosed and treated for Parkinson's disease. More recently, that diagnosis was revised to progressive supranuclear palsy, PSP, a rarer and unfortunately more aggressive condition. This journey from uncertainty to diagnosis and then living with a progressive neurological condition has profoundly impacted my family. I've witnessed firsthand the critical importance of early diagnosis, specialist care, emotional support, and above all, hope. Since becoming a Member of Parliament, I've spoken to many constituents across Farnham, Borden, Hazelmere, Liphook and the surrounding villages affected by Parkinson's, and I have been inspired by their bravery and strength in responding to the cruel difficulties life has thrown at them. Parkinson's has no cure, as honourable members have said, and that is one of the many challenges people and their loved ones face upon diagnosis. But thanks to advances in research and medicine, there are ever-improving treatments to help manage and relieve symptoms. As a result, many people with Parkinson's can have a normal or near-normal life expectancy. Physiotherapy, occupational therapy, and medication can help relieve symptoms and enable people to stay living independently at home for longer. In my own constituency, people with Parkinson's have benefited from free membership of local leisure centres in Whitehill and Borden and in Hazelmere, helping them to keep active and manage their symptoms. But there is so much more to do, whether that be research, diagnosis, treatment, and hopefully a cure. Earlier this month, ahead of World Parkinson's Day, like the Honourable Member for Hertford and Stortford and the Honourable Member for Strangford, I met with Parkinson's UK and individuals affected by the condition. I heard powerful accounts from volunteers about the daily challenges they face, mobility issues, speech difficulties, and the emotional toll on themselves and their families. I commend Parkinson's UK for their tireless work, providing advice, support and advocacy at every stage of the Parkinson's journey. Help is available via their website and helpline, and I encourage anyone who needs support to reach out. But as the Honourable Member for Bathgate and Linlithgow mentioned, there are still many who do not know what support is actually out there, and this must change. I want to praise the local charities, the volunteers across my constituency and across the country, as raised by the Honourable Member for Gainsborough, and the work that they do. Like the Honourable Member for Aberdeen North and Moray East, I have experience working in healthcare, and during my tenure with the NHS Getting It Right First Time programme, I was involved in the publication of the Neurology National Specialty Report. The analysis in that report highlighted significant variation in neurology services across England, particularly in managing conditions like Parkinson's disease. Key conclusions included the urgent need for timely access to specialist neurology services, the development of standardised care pathways for chronic neurological conditions, the expansion of the neurological workforce, including advanced practitioners, and much better data as my honourable friend from Meriden and Solihull East mentioned. These recommendations are essential to reducing disparities and improving outcomes. So, can the Minister today commit to addressing these three priorities in more detail, beyond just general references to cutting waiting lists and updating the workforce plan? Medical research in the UK is funded by both public and private sectors, Madam Deputy Speaker, as I'm sure you know, and as well as charities and non-governmental organisations. In 2022, nearly £250 million was spent on neurological research, including Parkinson's and other neurodegenerative conditions, across 1,873 individual projects. Parkinson's UK and Cure Parkinson's alone contributed £2.6 million. Under the previous Conservative government, we invested more than £79 million in research into Parkinson's disease between 2019 and 2024. In the year 22-23, the National Institute for Health and Care Research enabled 114 studies related to Parkinson's through its infrastructure. We also rolled out a new treatment for advanced Parkinson's disease through the NHS, starting in February of 2024, offering an additional option for patients whose symptoms were no longer responding to oral medications. So I'd be grateful to the Minister if she could confirm this government's plans to continue with this momentum. What research funding will be maintained or increased, and what new treatment options are being supported or explored? We also made progress in workforce planning, recruiting record numbers of doctors and nurses and publishing the first ever NHS long-term workforce plan. That plan recognised the need for more specialist nurses and clinicians in areas like neurology. The new government has committed to updating that plan, so I ask, will they retain this level of detail, and will they maintain the focus on specialist roles needed for Parkinson's care? Secondly, Madam Deputy Speaker, I want to raise concerns I've received from constituents regarding recent shortages of medications, such as amantadine and apomorphine, which have real distressing consequences for people trying to manage their condition. The government rightly has acknowledged these supply constraints, but I ask what action is being taken to restore and secure access to these medications. We have also heard concerns about the potential impact of President Trump's proposed pharmaceutical tariffs. What assessment has been made of the risks this could pose to access and affordability of Parkinson's treatments? Turning to the Labour government's record to date, I believe that Parkinson's has yet to be identified as a strategic priority. So can the Minister confirm what level of funding is being allocated to Parkinson's research this year and how this compares to recent years? There are also wider concerns about the implications of tax and benefit changes in the budget, as the Honourable Member for Strangford raised, including the national insurance rise. Many people with Parkinson's rely on social care services, which are not exempt from these national insurance rises. So I ask the Minister, has any assessment been made of the extra costs this will place on local authorities, charities and self-funders? Charities such as Parkinson's UK do extraordinary work, but they too are affected by these rising costs. How are ministers engaging with the charity sector to understand how higher taxes and squeezed funding may threaten support services or reduce research investment? We know that neurology waiting times are already among the longest in the NHS, so will the Minister outline a targeted plan to address this specifically? Will the government also publish a long-term strategy for neurological conditions, including Parkinson's, with clear plans for service integration between the NHS and social care? A multidisciplinary, multi-agency approach is vital for people with Parkinson's to live full, independent lives. Finally, what guarantees can the Minister offer that recent restructuring in NHS England and DHSC will not worsen access to Parkinson's services, delay initiatives or harm the continuity of care? With 50% cuts to integrated care boards, can the Minister reassure people with Parkinson's and their families that they will not be disadvantaged? Madam Deputy Speaker, the House is united, I think, in wanting to improve treatment, support and outcomes for people with Parkinson's. We hope the government will listen carefully to today's contributions and respond with clear commitments that includes action on workforce, waiting times, integration, support for carers and access to research and innovation. Parkinson's is a relentless condition that robs individuals of independence and dignity. But with research, investment compassionate care and community support, we can fight back. Madam Deputy Speaker, the Conservative Party stands ready to work constructively with the Government and with members from all parties to ensure that progress is not only continued but accelerated. Let us match awareness with action, for only with action comes hope.
I call the Minister.